I know that I believe you used to have massage therapists on your staff, still do
We
at your
do.
clinic, right?
We
Can you
do.
talk about that and why you implemented that as well? Because some people just see massage as a relaxing, nice spa time, whereas I think
Right.
massage therapists and people that understand it see it as something else. So why did you bring them on staff?
There's a real synergy uh, between chiropractic, massage, physical therapy, even throw in acupuncture and some of these other modalities. Um, Going back to just the joint, trying to get joint movement going. So, for example, I don't know if you've experienced a cavitation when you've been adjusted. But a cavitation basically is when you adjust a joint, specifically a synovial joint in the spine, um, you stretch the joint to where the bone gaps a very slight amount. It's encapsulated with synovial tissue. When you get that gap, it creates a chemical reaction. Chemical reaction causes a gas bubble to form. Gas bubble pops. So you feel and hear this popping sound. You can feel it. You might move your back and feel something pop. That's kind of what's happening. And by the way, when that happens, the popping sound that you're feeling when you're moving your back means something else is not moving, causing that one that's moving too much to pop. That kind of thing. So essentially, going back to the connection between massage therapy, when we do that adjustment at that synovial level, you have a kind of a super stretch on these tissues. It's called the paraphysiological end range of motion. So you've taken that joint to its full potential, but not to an injurious point. It's just its full potential. And you can't get it without the adjustment. That's what sets a chiropractic manual adjustment apart from just any other therapy. You can't massage it. You can't exercise it. The only way you can get it is if you do that cavitation to get to that full potential. So when we do that, that is root movement. If you think of the spine being the root of movement, like a door hinge, and then all the connective tissues that are surrounding the spine going all the way out to the larger muscles, the glutes, the paraspinal muscles, the abdominal muscles, all these different big muscles. When you get better root movement, that's going to allow less tension on the connective tissues. Less tension on the connective tissues, less tendency for inflammation, less pain. And then if you go the reverse of that, you work from the muscles in to the root of movement, you're going to get that same synergistic reality. If I do an adjustment at the joint level and then they get good work done on their larger muscle groups, less tension on the joint because these other muscle groups are performing better. So it's a real synergistic approach to care. And yes, it does have, the potential, soothing spa-like effect. But that's okay. It's an emotional benefit, and we talked about a little bit earlier when somebody's having an emotional part of their trauma. Massage therapy can be very soothing, as well as the adjustment. Like I said, the adjustment itself can be very positive for endorphin release and things of that nature. So it's a very positive synergistic approach. Now, massage itself, many times the type of massage I'm going to want, especially on my sore rotator cuff muscles, is very deep pressure. And, I like to get deep pressure work done. I have not experienced Rolfing. I don't know if you have. I've watched Rolfing, and I'm pretty sure I'm not going to be man enough to go through Rolfing. But this is pretty brutal
It looks a little torturesque. Yeah.
and it's really about breaking down tissues
Yeah.
to where they rebuild and repair themselves
Right.
better. Just exercising, you're going to break down tissues and then they rebuild and repair themselves. When you do anything, physiologically, that's going to happen. You're walking for a mile, you're breaking down tissues and you're causing them to rebuild and repair themselves better. You're causing the bone to be stimulated so that it rebuilds and repairs itself better. So all of these things may seem to be insignificant, but that's where we kind of have that mindset going into it, that we really don't get just how complicated this human body is and what really is happening. And that's what's exciting about chiropractic, massage, those kind of things. It really digs into, helping the body do its thing better.